Welcome to the Spinal Surgeries question and answer. And we're dividing this up into two different sections. One section that we can put on the standard social media. The other section, the uncensored version, will be on the Dr. BVIP. Let's get into this. Question 1 from Steve Hodge. I've had 11 back procedures, 1 fusion in the lower, L4, L5, partially removal of fusion. I still have sciatic nerve damage and low back pain. Stay away from surgery. What is my best option for relief? Steve, let's get you healthy. Okay, so when you look at this, the way the surgeon interprets where the problem actually is they're using an MRI. And that means that you're laying on a flat area, gravity pushes down, table pushes up, magnet spins around. Now, inflammation can distort it. But think of this. It hurts here. They're looking there for the problem. Okay, but that doesn't factor into why the problem is there. And it's not from picking up something and you blew a disc then. You've got to look at the entire biomechanics of the spine. So to correct the problem, you got to look at beyond the symptoms. And so if you've had a pain there, and this could have been a pain back when you were a teenager, and your body is going to adapt in what's called an antalgic lean. We're going to be leaning away from the site of injury. Leaning away from the site will relieve the pain. So the back pain will go away, but the entire biomechanics has changed. And the body can adapt to that. But with that abnormal force loading, the structures are going to start to change. So look at that L4, L5, the 11 back procedures. You got to look at the entire structure, but that's not the only thing. Okay, you've got to look at the cervical spine, because if the loss of curve in the neck, if there is a loss of curve in the neck, head's going to go forward. You're talking about a 12 to 15 pound head massively forward. That's going to cause the thoracic area to increase the curve, changing the force loading. Plus, knowing that this has been going on a long time, the pelvis for sure will be unstable. So check out our pelvic health videos. But there's also, you need to change the biomechanics of the feet, the knees. You've got to change the sleep patterns. Okay, but once you look at the entire structure, you're going to find out why the back has been a problem. Because 100% of the time, we're going to see a problem with the cervical spine, thoracic spine, altered mechanics of the knees, feet, unstable pelvis. All of that are going to be contributing factors. So look at the entire structure. Staying away from surgery, well, again, surgery isn't fixing the problem, and it's not asking why the problem occurred in the first place. And surgery alters the biomechanics. So this is why long-term surgery, it does alter how the body adapts. But look at the entire structure, and you may be able to avoid surgery, but you are going to be correcting the problem. And then also look at sleep patterns, look at nutrients, look at the emotional component, but restoring the biomechanics of the feet, knees, pelvis, thoracic area, cervical spine, and then finding somebody that's going to identify that problem, but then they take a second x-ray to document that they fixed it. And that's a real good solution. Question 2 from Mary Stolesis, 9492. I had a bilateral laminectomy and L4, L5 fusion in January 2018 for severe spinal stenosis and spondylolisthesis. Now I'm disabled by severe intractable chronic low back pain. I've since wondered what went wrong. The surgery apparently went well. The hardware is still intact. What happened to make my pain worse? I've been in pain management for 6 years and counting. Mary, let's get you healthy. One of the challenging things that I have with surgeons is they're not asking why the body malfunctioned in that area. Just figure hurt here, pain here, surgery there, but that doesn't explain why disc would be a problem. And then what do you consider success? The general term is when you've had spinal surgery, if you knock the person out, do the surgery, wake them up, that's a success. If pain has changed or altered in the bed, in the positive, that's a success too. But really, the successful of the surgery, their gauge is, did they knock you out? Did they wake you up? And was the surgery done correctly? Bitchin'. Except that's not addressing why the problem is there. Now, knowing that it's been a laminectomy, L4, L5 fusion, We've got to look at pelvic instability. We've got to look at the altered biomechanics of the feet, knees, but you've got to look at why that occurred in the first place. And it was not from lifting or this or that. You've got to look at the entire structure. So get to somebody that's going to look at the entire structure. And I'm talking the cervical spine, because if there's a lateral deviation of the thoracic area, which is uber common. I mean, this is only 100% of the time I've seen this. If you have back pain, your body is going to lean away from that painful area so that you feel better. And so the back pain will go away, but your entire structure has changed. And your body can adapt to that, but it's eventually those structures are going to remodel to that new force loading. So find somebody that's going to take a cervical, thoracic, lumbar, and restore those. Then look at physical, chemical, emotional stress. So look at exercises to restore the curve in the low back. Where they did the fusion, you can't work on that site, but knowing that it's L4, L5, the pelvis for sure is going to be unstable. So you've got to stabilize that pelvis, change the biomechanics of the feet, the calf, the knees, how your body walks and adapts. And then you have the best chance of recovery and regeneration. But you got to look at the emotional component. You got to look at, since you're in pain management, that's usually just drug therapy. And if you're taking opioids, there's actually a hypersensitivity or an increase in pain if you've taken opioids more than 5 days. So look at other therapies, things to regenerate. Look at a live blood cell analysis so you can see if the blood is healthy, because under stress, and that's physical, chemical, emotional stress, the blood becomes thick and it's hard to have that carry oxygen and to start to heal the tissue. And looking at all of those factors, then you have the best chance of tissue regeneration, because that's the key. It's not, ow, 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 it hurts here. It's your body is in a completely stressed state, and your body isn't building healthy cells. And if they're giving medications such as muscle relaxants or anti-inflammatories or opioids, all of those three limit the body's ability to regenerate tissue. So get to a corrective or a good chiropractor that's going to take an x-ray, do a series of therapies, do a post x-ray, and they're familiar with post-surgery cases where they're addressing sleep patterns and biomechanics, and then you got the best chance to regenerate. Question 3 from Vicky Lynn 10. What can you do about a disc tear? My daughter was in a car accident last year and still has a lot of pain in her neck and lumbar tear. She saw a chiropractor for several months after the accident. She believes that they made her lumbar pain worse. Super common. She is thinking of surgery, but the surgeon suggested that she get steroid shots. First, I'm sending her your video to watch. Thank you. Oh my gosh. Vicky Lynn, let's get your daughter healthy. Okay, to damage a disc requires a huge amount of force loading. And just at the side of pain is not the side of the problem. One of the common factors of a chiropractor working on someone is, particularly with a lumbar disc issue, that's going to spasm out the muscles around that area, and they're called the paravertebrals, and they're not under conscious control. So anytime you damage a nerve in that area or the disc, which is going to be affecting that proprioception or that communication from the body to the brain, it's going to tighten up and make those joints, the muscles, tighter, which limits and alters the biomechanics. Now, a chiropractor may loosen up those muscles, which I don't recommend. They may also adjust the pelvis, which is fantastic. It's big, it's easy to grab. You can blast it home. There's a big pop. The patient feels better. And typically, if you're adjusting an unstable pelvis, immediately after the adjustment, that will feel better. But then by the time the person gets back home, it's going to hurt worse. So this is why we recommend stabilizing the pelvis until you correct the entire problem. Now, knowing that the neck is also an issue, you're looking at 20 to 50% of low back problems are coming from the neck. Just think of this. If you've got a normal curve and your head's balanced, beautiful. You've got that good force loading every time you walk. If the loss of curve in the neck is going to cause an increased curve of the thoracic area, or if there's a structural deviation, you're talking totally altered biomechanics on the lumbar. So you have to get someone that's going to take an x-ray, do a series of therapies, take another x-ray to document the structural changes. But based on hers, I mean, the steroid shots are completely insane. because when you're injecting that area, you're not helping that area regenerate. In fact, they have a limit of steroid shots in a lot of different states of America where you can't do more than 3 because more than 3 deteriorate the bone and deteriorate the cartilage or the ligaments in that area. And that doesn't make any sense at all. Inflammation is a healing process of the body. It's not the source of pain. The pain is an alarm telling you that there's a problem. Now, if she's taken non-steroidal anti-inflammatories, that destroys the building block of cartilage. She's going to have poor sleep patterns. She's going to have anxiety. So when we're fixing someone, you look at it as a tissue production problem. So look at the entire structure, take static and stress x-rays to identify where the problem is. Typically, it's going to be above or below where the surgeon or the doctors are working on, because they're using an MRI, which is not looking at the entire structure. MRIs are done just on the area where the alarm is. And when I say alarm, I just mean pain. So looking at the entire structure, stabilizing the pelvis, looking at feet, knees, gait. Look at our foot and pelvic health videos, hugely important. But then look at nutrients, okay? Look at the things that will utilize inflammation to heal the body, such as omega-3s, vitamin C, juicing, blending, getting the raw materials. Look at digestion as also a factor. Look at sleep patterns as a huge factor. And she's going to say, yeah, but the pain wakes me up. Look at our sleep-restricted videos so you can reset your circadian rhythm. Look at the emotional component, because when you're emotionally stressed, all those muscles on either side of the spine tighten up, just like a cat. A Halloween cat's like that. Humans are the same way. So addressing the physical, chemical, emotional stress, stabilizing the pelvis, then she has the best way to get corrected. Let me know how she's doing. Question 4 from Ulrich 8707. I have a broken L1, L2. It's been 2 years, so the pain is mostly gone, but more of an irritation when triggered. I was hoping you would have covered the different balloon, cement, mini jack techniques for restoration, trying to decide whether to live with it or augment it. I'm not a big fan of the balloon, the cement, the mini jack, or doing that. That is the last resort. Now, you say you were a patient of mine. Buddy, do the exercises, okay? This is going to be huge because L1, L2, this is going to affect digestion. That's where the spinal cord stops. So being a patient of mine, we've walked you through the thoracic, cervical spine, stabilizing the pelvis, correcting the biomechanics of the feet and knees, mobilizing the area above and below that trauma. All of these things are going to keep the pain level down, but it's going to start to restore, because with a broken L1, L2, you've completely altered the biomechanics of the thoracic, lumbar, pelvis, everything. So look at all the stuff we talked about. Look at the sleep patterns. This is when the body regenerates. So do the sleep restrictive therapy. We teach all of our patients neurolinguistic programming to de-stress out the emotional component as well as heal it. Get to a corrective chiropractor in whatever area you're in so they continue on with the corrections of restoring the cervical spine, changing the biomechanics of the thoracic area. Do the twisting exercise that we suggested as well to mobilize that thoracic area. You can't, and you got to get somebody to traction the fractured area like we were doing, okay? Because you can't really, let me see. Okay, when you got a fracture, and this is huge that you understand this, and you do because you were a patient and we explained it. A pathologic fracture is the entire bone was squashed. A traumatically induced fracture means the structures on the back half of that fracture are still good, that the bone crushed on the front. And so that has to do with blood acidity, osteoporosis, or abnormal force loading, such as falling off a building or something. But as long as the nerves, which exit the vertebrae on the back half, it usually has good integrity. So to correct the altered biomechanics, you've got to get on a traction table which separates those joints. And that's what we were doing. And even if the fracture is years old, if there are living structures there, and you can tell it by bending one side, bending the other side during a stress x-ray, If there's any movement at all, you can increase that disc height through axial traction as well as lateral flexion. And that's one of the methods that I totally recommend. You can have any chiropractor in any area that you're at. Give me a call. I'll walk them through it. Then I'll have your x-rays. And I'll know exactly how to walk them through, how to get you back to healthy. The cement, the mini jacks, all the other things actually alter the mechanics further. And I haven't seen those effective, but do all the exercises that we've given you, do all the therapies that addressing the sleep patterns, juicing and blending to pre-digest the nutrients so you get the nutrients in there, do the supplements to help inflammation regenerate the body, dealing with the emotional component and stabilizing that pelvis. And I mean, just get to a good chiropractor, and if they have any questions, I'll help them and walk them through it. Now, if your question wasn't answered, get to the Dr. B VIP site, and your questions will be answered there. God bless you. Stay healthy, my friends.